I'm Mason with Live Oak Testosterone here in San Angelo, and I'm going to say it. You do not need to check your serum estradiol level if you're a guy on testosterone. That number doesn't tell you what's actually happening in your tissues. In this video, I'm going to explain why estradiol doesn't tell the whole story, what really causes gynecomastia, or gyno, and how to tell the difference between normal adjustment, fat, and true glandular growth. We'll cover why that early nipple sensitivity freakout is almost always temporary, when you should and shouldn't worry, and how we manage true glandular tissue, and why crushing your estrogen with blockers can actually make things worse for your erections, your mood, your joints, your heart. Because too many guys start TRT, feel a little tingle, read 3 Reddit threads, and go nuclear on their hormones for no reason. The truth is, estrogen isn't the villain. Bad dosing, bad advice, and panic are, so let's fix that. Serum estradiol does not need to be checked in a male. This is an endocrine process, which is a fancy way of saying what's happening in your tissues doesn't always show up in your blood test. The blood level is not reflective of what's happening in the tissues. I've discussed this in detail in another video, but I'm going to hone in on gynecomastia specifically with this video. The dreaded man boob, or as the internet calls it, gyno. So let's get clear on what we're actually talking about. Gynecomastia isn't just chest fat. It's the growth of actual glandular breast tissue in men. You can feel it as a firm disc or lump right under the nipple. It's not just soft fat. It does this when hormones get out of balance, but it's not just estrogen alone. It's a combination of testosterone, estradiol, prolactin, IGF-1. So it's not just one bad guy. Here's what usually happens. A guy starts TRT, feels a little bit of nipple tingling or sensitivity, and immediately panics. He jumps online, reads 3 Reddit threads, and suddenly he's ready to nuke his estradiol like it's the final boss in a video game. Let's take a breath and let me save you some anxiety. That sensitivity is common and temporary. It typically is going to go away in 8 to 12 weeks. Your body's just adjusting. Think of it as you're going through puberty again, puberty 2.0. A little bit awkward, a little bit emotional, but you'll come out better on the other side. Again, most guys are fine after 8 to 12 weeks. There's no need for an estrogen blocker right out of the gate because your overblocking estradiol can wreck your mood, your joints, raise long-term cardiovascular risk, worsen erectile health. And so it's like trying to fix a squeaky door hinge with a sledgehammer. Some guys actually have a bit of gyno from puberty, and it actually gets better with optimal and stable testosterone levels. Now, let's be honest. Most of the guys who think they have gyno are just fat. If you're over 20% body fat, start there, decrease that. Chest fat loves to hang out and can look identical to true glandular tissue. If you're lean and you still feel a firm lump under the nipple, that's when it's worth getting checked out. If true glandular tissue starts forming, occasionally we can calm things down with the SERM, selective estrogen receptor modulator. It cools receptor activity in the breast without wiping out estradiol throughout the entire body. But once that tissue fully develops, surgery is going to be the only definitive treatment. A good surgeon can remove it cleanly and restore your chest contour. However, if you ever notice a hard lump, irregular mass, or one-sided swelling, get it checked out. Men can get breast cancer as well, and you don't want to miss a breast cancer thinking that it's just a little bit of gyno. So why does everyone blame estradiol? Because in bodybuilding and heavy anabolic use, hormones just go off the rails. High dose testosterone, estradiol goes way up, IGF-1 is way high from growth hormone, prolactin from things like tren or nandrolone. The combo is like inviting every hormonal villain to the same party. And then, of course, gyno is going to show up. But that's not testosterone replacement therapy. That's mad science. If you're stacking 5 compounds, you're basically a human biochemistry experiment. Respectfully, you're going to get what you get. So here's the bottom line. On appropriately managed testosterone therapy, gyno is rare. Early nipple sensitivity is common. It's temporary. Most gyno is just body fat. True glandular tissue, only surgery is true definitive treatment. And if you're suspicious about anything, just get it evaluated. So don't panic over every little tingle. Trust your provider. Get a competent provider who provides appropriate testosterone therapy. Stop blaming estradiol for crimes it didn't commit. Your estradiol is not the villain. Your compounds, your dosing, your frequency, your lifestyle, and sometimes Reddit threads are the true villain. If you're liking this content, be sure to like and subscribe if you haven't, and be sure to get out there and do something today that your future self will thank you for.